I'm really hopeful that we're going to hear something come out of tomorrow and that we can start to chart that path forward.
Canada's premiers are in Ottawa to meet with the federal government to work out an accord to stop the decline of Canadian healthcare. According to a senior federal official, Ottawa is proposing a decade-long plan to fund and reform Canada's healthcare system. The funding, reportedly $70 billion, will see an increase to the Canada Health Transfer and funding for bilateral agreements with provinces and territories to deal with their specific needs.
Premiers should really think twice about what they're getting into here and what they're setting up for the next 10 years.
The new funding will come with some stipulations to ensure provinces don't swap in federal cash and cut their own health budgets. It's also being reported that measures will be in place to make sure the money is spent on the public health system as opposed to private expansion. Bacchus Barua says there was a similar approach by the Liberals in the past.
In 2004, we had the Canada Health Accord, which pumped in a lot more money into the system, which tracked 5 different procedures. And really, at the end of that health accord, the committee's assessment was that it was not a success.
A new Angus Reid poll shows that 2/3 of Canadians say healthcare is poor where they live, and both levels of government are to blame. The past president of the Canadian Medical Association, Dr. Catherine Smart, says there's a growing number of Canadians without access to primary care. Several ERs and EDs are closing across the country, and healthcare workers are burning out. Smart says it's imperative to have collaboration between the federal and provincial governments.
This is a shared issue. It's a shared problem. And I think to get to the solutions that we want to see, we need to see the federal government and the provinces working together towards that same goal.
The much anticipated meeting between the feds and the premiers was heavily debated in Parliament Monday.
Will the Prime Minister, yes or no, ensure every single dollar that goes into the province's hands are going to the public coffers for health care?
I'm very much looking forward to sitting down with the premiers tomorrow to discuss the future of healthcare in this country, the future of public healthcare in this country.
The provinces have been asking the feds to increase the Canada Health Transfer's share of public health spending from 22% to 35%. The premiers are also opposed of any conditions on increased funding, which reportedly is in the offer from the feds.
Very much looking forward to what that proposal will look like. We'll see that for the first time tomorrow, and so we know that that will be the beginning of what I hope is real progress for the future of our country when it comes to healthcare.
In Winnipeg, Karpa City News.